OSHA has several regulations in place when it comes to implementing first aid programs in general industry. Employers must comply to ensure that the safety of their employees, and some of these regulations include having first aid kits. First aid kits should be available. Employers should make sure that they're adequately stocked. Second thing as part of your first aid program is emergency eye wash and emergency showers should be in place for any employees that could be exposed to corrosive substances. Employers must train employees in CPR, especially in instances where there's no medical clinic or where no medical personnel can be immediately summoned. Now, there's no specific distance requirement for this, but OSHA's best practices just state that when you're reviewing your first aid program, you should take into consideration the distance and timing that it may take for medical personnel to arrive in the event that you have to call them. AED training is part of your first aid program. Any employee that's expected to use an AED or an automated external defibrillator has to be trained on the proper use and operation of that device. Bloodborne pathogens is another component of your first aid program. OSHA requires that employers have a written exposure plan for bloodborne pathogens and provide training to employees that could be exposed to bloodborne pathogens. And then tetanus vaccinations. Employers must provide tetanus vaccinations to employees who are at risk of contact or exposure to tetanus. These are just a few examples of first aid regulations for general industry. Again, depending on what your company does, you may want to check with OSHA, check on OSHA's website, search first aid, or if you need further information, you can contact one of us here in the Risk Management Department at Alacom. And again, always make sure that you like this video, subscribe to our YouTube channel so that you can be updated on future videos. Thank you.